He came to Swedish Medical Center hoping, expecting to get better.
Pretty much knew right away what it was, appendicitis.
He left, never envisioning
Yeah, I assumed it was some kind of mistake.
the visit would result in a lien on his Littleton home.
You have insurance, you have an emergency, it should be taken care of.
Emmett Malone's insurance covered the hospital bill, but no one told him the on-call surgeon had no contract with his insurance. And so when Malone's insurance decided to pay her a fraction of the total bill, the surgeon's billing company billed Malone for the balance.
I honestly didn't know that was even possible.
And when Malone refused to pay nearly $4,000, a collections company sued him and eventually placed this lien on his home.
Apparently that's what they're allowed to do, which is crazy.
Why would a surgeon working in their hospital not accept the same insurance plans they accept? We asked Swedish. They refused to say on camera. We did manage to ask the same question of the Colorado Hospital Association.
Unequivocally, hospitals want to find a solution to this problem.
Catherine Mulready says most hospitals don't employ most of the doctors who work within their walls. They work independently and thus are free to accept or not accept whatever insurance they choose. An issue, she says, leaves even the hospitals unaware of who is in network and who is not.
I don't know that we have any ability to track that kind of thing. It's certainly not the ability to track it in any sort of real time. So we don't know actually how big that problem might be.
Should you try to figure it out?
It's not information that we have access to.
What we did have access to is this. At Swedish, 5 of the 7 doctors who work inside this emergency general surgery and trauma department have used the same collections company that's placed liens on a lot of homes. By 9 wants to know's count, more than 170 homes since the start of last year, including the lien on the home of Emmett Malone.
I was actually relieved to hear that I wasn't the only one that this has been happening to.
To make matters more perplexing, Swedish is owned by HealthONE, and HealthONE has a company policy to not place liens on property or garnish wages for payment. So to review, the same hospital that says it's not going to put a lien on your home to get you to pay a bill seemingly has no problem giving privileges to a physician that will use a collections company that's going to do just that. Got it.
Should we not require hospitals to say, if you're going to work in our hospital, you have to agree to take our in-network rates?
State Senator Bob Gardner is contemplating authoring a law for the next legislative session that would do that. And it's not just Swedish. We found surgeons billing out of network at other HealthONE hospitals, as well as Centura hospitals. Our lien list includes bills from at least 8 metro hospitals. Don't you owe that to your patients to know more about what's taking place within your walls?
There's just too many variables, and hospitals don't have insight into that any better than the patient does.
Curious to know if even the surgeon who worked on Malone's appendix was aware of what her collections team was doing. I called her.
You have reached the Office of the Emergency, General Surgery, and Trauma Doctors of Swedish Hospital.
She, like almost every doctor I've called about this subject for months, never called me back. As for Malone, not long after we informed the state's Division of Insurance, the state informed him in this letter that he no longer owed the 4-figure bill. His insurance would reprocess the claim and pay the full amount. This shouldn't be this hard.
No, the whole system it's crazy.